and people, I think, COVID directly impacted every single American, and not in a good way, right?
No, there's nothing good about it.
And
the only thing good about it was a shift in perspective.
Right.
And that it's going to be way harder to pull some shit off like this again.
Right.
People are not going to buy into it, especially all those vaccine injured people who keep getting gaslit. Why do they keep calling it long COVID? How come nobody I know who wasn't vaccinated got long COVID?
Right, right.
What is this long COVID you speak of? Is there long flu? Where's the long pneumonia? What the fuck are you talking about? Why are you calling it? Is it possible that this is a vaccine injury? I'm just asking.
Well, yeah, I've been looking at antibody levels in these people, and it's alarming. So we really don't have a lot of tests for vaccine injured. It's hard because they'll get the $1 million workup. By the time they come to see me, they've gone through, multiple tests, they have multiple doctors.
It's not really $1 million, is it? The workup?
Well, I don't know, but I'm exaggerating. But
right. I just want to be clear.
I don't. It could be.
From some Vanity Fair came
exactly.
horse dewormer who claimed there was $1 million markup.
Actually, somebody should fact check me on that, and it's probably higher than $1 million, but. So they get they go through the workup, and then they can't find a test to prove that they're injured. So the doctors will put them on psychiatric medication. They'll put them on sleeping pills and benzodiazepines and antidepressants. Literally, I saw a patient was put on all three. So the only test that I have found that does seem to correlate is this antibody test. It's a spike protein antibody test. LabCorp has it. That's where I send people. Quest has it, but they put the upper limit as too low, so you don't really get a good sense. But the upper limit of the test is 25,000. And in people that have not gotten the COVID shots, I'd say it ranges, it's usually under 1,000. And then people that have gotten the shots, a lot of them are off the chart. They're over 25,000. But on average, they're probably 10 times higher than the people that have not gotten the shot. And this is people who were, they were vaccinated 4 years ago. It wasn't like they just got the shot. Obviously, COVID's not an issue anymore in terms of, people getting sick. But 4 years later, you should not have sky-high antibody levels. And that's what I'm seeing. And that is alarming. It just suggests that there is a lot of spike protein still in the body causing problems.
And haven't they shown that the spike protein continues to be produced in the body up to 700 days later?
Yes. That's one study. There's some, what's interesting in that study, that antibody levels were really low, which doesn't make sense. So I kind of questioned the whole study, but yeah, I see it. I see patients. I still see vaccine injured patients coming to me for the first time years later. Last week, I probably saw 6 new vaccine injured patients. And they're not getting any help. The government, it's called the CICP. It's a countermeasures injury compensation program. They're supposed to help these patients. They have denied 98% of people that have applied for assistance. They, on average, I think they've awarded 30 people, of all the vaccine injured that have applied, 30 people. On average, the award is like $4,000 for these people. It's horrible. These people's lives are just destroyed. These are not easy things to treat. It's not like I can give them an antibiotic and they're good to go and they're fine. They're very challenging. We don't have a lot of guidance. I do see a lot of success with ivermectin, but it's slow going. It's usually months of trying to help them. And the government really needs to help these people. There's a lot of people suffering. And they're getting completely ignored. The other issues, we don't even have a code. So every disease has a numerical code, and it's called an ICD-10 code. It's what they use to compensate people for, or the insurance companies use them, but also for tracking. So if you have, COVID has its own little code, and you can just dial on the code and get all the numbers. They don't have a code for vaccine injury. They have a code for vaccine hesitancy, but they don't have a code for injury. So all these people are just sort of, they're getting all these diagnoses, but there's no way to track them. It's a big problem.
How convenient.
Yeah.
Well, I would imagine the real problem with paying people is you'd have to pay so many.